Good afternoon, and thanks everybody for joining us here on this fall day. As I said before, my name is Jenny Maurer, and I'm the State Coordinator for Project Launch at the Department of Children and Families in the Department of Health Services. And today you're all here for a webinar on a community approach to developmental screening using the developmental screening tip sheets number 4 and 5. I want to thank you all for joining us, and I also want to thank my co-presenters. We have Lily Irvin Vitella from Supporting Families Together Association, Paula Breeze from Family and Child Care Resources of NEW, and I'm not sure what NEW stands for, Northeast Wisconsin. There we go. And we also have Sarah Inman from Brown County United Way, and we're so thankful that they're here to share their experiences with us, and we're really appreciative of their time. And I didn't put the slides on slideshow. Let's do that. Okay, there we go. Okay, so again, thank you for all of you for being here. Okay, so before we start, and as was shared with you in your reminder email, we're going to be covering 2 tip sheets today. And if you haven't had a chance to take a look at those tip sheets, right now would be a great time to click on either of these links or the link that was shared with you in your email. We're going to be looking at tip sheets number 4 and tip sheet number 5. So you have a quick second to access those tip sheets. So take a look at those, and we'll be referencing those throughout the webinar. Okay, so today the outline of our webinar and our focus will cover a couple of different topics. Lily will be leading us through an orientation of the developmental screening tip sheets 4 and 5. She'll highlight some key ideas and strategies, and then we'll turn it over to Sarah and Paula to talk about local collaborations and examples from their community. And finally, we'll open it up for some questions and discussions about implementation. And we'll be doing the questions using the questions box that's on the GoToMeeting, the webinar software. So you can type your questions in as they come up, and we'll address them at the end. But we're not going to unmute any of the lines, so just note that you'll be putting your questions into that box. We'll do our best to answer all of the questions, but we might not get to all of them. But we'll really try to take that feedback into account and hopefully provide some information once the webinars are completed. So now I'm going to turn it over to Lily to get us started.
Thanks, Jenny, and thanks to all of you for being on and taking time out to prioritize that. I know that folks have a lot of things going on in their busy days, and so to step back and take a look at how it is we engage stakeholders in developmental screening efforts and how we promote successful collaborations, it really says quite a bit about you all, that you know how important those relationships are in order to build strength-based relationships with families to get good supports and services to children. So the big things that we want to, so I'm hoping folks have in front of them a copy of the tip sheets. And you can know that you're looking at the right tip sheet if it looks like the image to your right on the screen. In the image you'll see a picture of Lizzie smiling beautifully. She's there with some children and a provider as well. And you all may well remember Lizzie because she was one of the co-presenters on the last call in this webinar series. All right, so being at the same place. So the first thing that we really want to dive into in terms of content is really understanding a meaningful role for stakeholders. So tip sheet 4 has some information about that, and it also has a list of who some of those partners might be, as well as who some related allies might be in terms of supporting developmental screening efforts. So while there is no fast and hard rule about who all of the stakeholders should be, important questions that communities need to ask themselves are who is already doing work in the promotion of understanding child development, in the delivery of developmental screening, in the service end of things if children come up with screens that warrant future action. And so if you ask yourself those questions about who might have a role or a step along the way, that gives you a really good idea of who should be having those conversations. And meaningful roles for all stakeholders doesn't mean the exact same role. Depending on where we sit, that sometimes determines where we stand in a collaboration. And so if we're doing work in a community, but our role isn't a direct service role with families or a direct service role with children, then likely we're not the right place to be delivering the developmental screening. And yet, we could have a very meaningful role in promoting understanding and public awareness about the campaign and about developmental screening, even if we're not the ones who are facilitating or guiding the actual developmental screening implementation. So there's just that idea. So one of the things that I know is true as well is that the communities all around Wisconsin, while there are things that we all have in common, like our love for children and our understanding of supporting families so they can do right by kids, there's also a lot of differences from community to community. And one of those big differences that's quite noticeable at times is the difference in terms of resources. And so there may be ideas in terms of who the partners and who the allies are, and in your community, those partners may not have as robust a role because of funding issues or because of staffing capacity. And so we understand that and appreciate that and respect that. And so you're going to hear some things as I continue to go through this tip sheet that you're going to completely resonate with. You're also going to hear some things that you say, it looks a little different in my community. And I really invite you to hold on to those ideas because we have a lot to learn from each other even in our differences. And so when we get toward the end of our time together today where we open it up for more discussion and we're taking your questions coming in from GoToWebinar, I really hope you're willing to share some of those distinctions and really help us to frame the conversation. So, so three big questions that we can ask ourselves related to who we engage is, how do we connect with families with young children and engage them in a screening system? So there are some families that we work with in our communities who make a point of contact with opportunities for developmental screening frequently. So take, for example, a family that might have access to health care and be using that health care, and they may be screened in their pediatrician's office. And they also might be a child whose family has been identified to receive supports around home visiting. They may also have developmental screening there. And they also may be a child who has the great good fortune to be in a high-quality early care and education setting, whether that's Head Start or 4K or child care, and they may be screened there as well. And you know, in communities, we spend a lot of time talking about, oh my, there might be just children and families being screened left, right, and center. And I would love for that to be a more prevalent problem. But at this point in time, that level of systematic support where children can or families can predictably count on their children being screened accurately using an evidence-based tool, and then being connected up with the appropriate resources as follow-up, that's not the experience of most children in Wisconsin, and it's not the experience of most children in the United States. And this really drives home the importance of why we must work in partnership, why we must identify stakeholders, because in the absence of having meaningful roles for multiple stakeholders who touch the lives of children, we run the risk of operating in our silos and having children miss the important supports that we well know how to deliver, but we often make the disconnect when it comes to actually following through and giving children and families those opportunities. Sometimes those stakeholder groups are already together, and so I don't want to pretend that just because we're talking about this on the webinar today that we don't recognize as part of the group of folks who put together these tip sheets that there's a lot of really great stuff already happening and that there are a lot of relationships that are already in place. And so if you have been working on this for a good long time, or you've been working on other things in early childhood or family supports, and this has come to the top of your agenda in terms of what you want to be focusing your time, energy, and talents toward. We appreciate that as well, and see this tip sheet as a way to go back and bring some fresh eyes to the work you're doing to strengthen your referral and communication lines. Um, there was a saying that comes around quite a bit in groups of folks who are talking about developmental screening, and it's that idea of screening for a purpose. We're not screening just for screening's sake. That has some minimal benefits for children, but the real benefit for children and families comes when we take the results of screening and then we use that to individualize supports to the child and family, and when we do that in partnership with families. And then the other thing that we can do is really think about when we're bringing folks together and we're identifying meaningful roles, to think about how we stay on the same page. So depending on, again, where you sit, you may be more connected into and finding out more about opportunities for professional development, for coaching and consultation, for communities of practice, and for training. And there are a lot of the exciting thing, and you heard a lot about this last webinar as well, is that many systems within the early childhood, or many sectors within the early childhood system, are putting time and energy and emphasis into training and screening promotion. And yet we're not always on the same page. We're not always getting access to the same information. And so really thinking about how we're sharing those professional development opportunities to keep everybody on the same page and clear and productive and effective in their roles is really key to both engaging folks and keeping folks engaged. Because I don't know about you, but I'll tell you about one of the things that I've noticed is that when the meaning or the purpose of work becomes unclear, my willingness to stay engaged and give my time and energy and talent becomes diminished. And I think that that's true of most human experience. And meaningful engagement means I'm not going because I gotta, I'm going because I have faith and vision that this is going to result in good outcomes for children. All right. So the next thing that I'll just point you to is look at that list of who those partners might be, and know that birth to 3, early care and education, child care resource and referral, community action agencies, CSAs, family resource centers, Head Starts in all of their variety, health services, home visitation and parent education programs, medical clinics, the regional centers for children with special health care needs, and schools all have a hand in the game already with developmental screening. And communities who are really moving that ball forward and are really responding appropriately to the developmental needs of children are communities where all of those folks are talking, and not where they're only talking to each other, but they're asking themselves, who else in the community do we need to be reaching out to make this as effective as possible? Where are children and families already convening, where we don't have to ask them to add on and come do one more thing, but we add value added to experiences that they're already engaging in on a regular basis? And then it's also helpful just to look at who those related allies are. And so I guess I would just put the shameless plug out there to never underestimate the power of related allies. And we're going to be hearing a bit about that in a bit when Sarah and Paula talk more about some of the efforts there in Brown County, because their philanthropy has played a big role as a convener. And then the final thing I'll point out for you on the tip sheet before we go to the next is just what some of the resources are. So if you ask yourself, who are your partners and what are their roles in a universal screening initiative that's most likely to result in good outcomes for kids, then sometimes as we bring folks together, it's helpful to have other resources. So on the next slide, you see great resources. There's one that's Child Find Ideas That Work, and it really helps to think about how to strengthen those referral systems so that way we're not just screening for screening's sake. It also helps you assess what your collaboration is, and so there's a collaboration factors inventory. And then in Wisconsin, there's there's legislation that supports at both the federal and state level, as well as resources Wisconsin Child Find efforts. And so there's no wrong door if you call Child Find in terms of figuring out who those communities, other stakeholders might be in your community. So that's it for tip sheet 5. So now let's take a look at, or tip sheet 4. Now let's take a look at tip sheet 5. And so once you have folks engaged and you're wanting to keep folks engaged, it's really a call to action to be intentional about how we collaborate. And collaboration at its best isn't, hey, I'm going to come up with a brilliant idea, I'm going to do all kinds of thinking, I'm going to get pretty set in my way in what my plan is, and then I'll call on other folks to get on board and support me in trying to achieve whatever my great vision is. While that may work in some instances, it's usually difficult to sustain. And so really this tip sheet asks folks to take a look at really being intentional about promoting healthy collaboration. One way to do that is to really focus on a community approach to developmental screening. And a community approach doesn't mean that there's not very specific things or plans that are going on within specific organizations or specific programs. Rather, it just means that if I'm doing something very specifically in my Head Start or in my child care or related to birth to 3 or in my school district, I'm really making sure to talk to those other folks who are doing work so that we're learning lessons from each other's efforts, even though our settings may be very different. Kids are kids are kids, right? And families are families are families. So that really points to the next area in the tip sheet, which emphasizes inclusive planning. And so, get people involved early, get them involved in a meaningful way, and when you do that and people are part of developing the plan for community-wide implementation of developmental screening, you're more likely to have buy-in if people felt like the strengths and the challenges that their organization experience around developmental screening have been discussed, addressed, and planned for. So it's not about pretending like everybody can do everything. It's about coming and having those really frank conversations about where people's resources are best directed, which really leads well, so in terms of that best direction, to inclusive implementation. And so although there are folks that aren't going to necessarily have a role in administering a developmental screen, and nor should they, in all cases, that doesn't mean that they're not, there are stakeholders that aren't equally capable of really supporting implementation. So I guess I would just encourage folks to think creatively about how you're sharing data, because while local media may not be a usual ally or stakeholder, local media can help celebrate the success, can help promote if you're doing community days that involve developmental screening, or they can help tell the story about why it's important for families to be engaged in developmental screening. So they can help destigmatize what are sometimes difficult conversations about child development, but they can't do that if we're not involving them in the implementation. So one of the things that we have on the right side of tip sheet number 5 is a very snapshot explanation of a methodology that can be used to keep collaborations going forward in a successful way. So that way we don't get stuck in planning the plan and planning it some more. Plan, do, study, act cycles really promote rapid cycle quality improvement processes or implementation processes. And so folks come up with a plan that's based on an agreed upon aim and some agreed upon strategies. They do it, they study it, looking at data in a really simple way, and then asking themselves, hey, was our aim achieved? And then they act. And acting may be, great, this was fantastic, we love it, there's nothing that we could do better. Now our only work is to get that opportunity out there to more people. For others, acting might be saying, ooh, we really meant well by doing that community fair, but our promotion wasn't quite what we wanted it to be, so there were more professionals there than families. Next time, we're going to put more emphasis in our action around promotion of the opportunity and explaining it well so parents really want to come. Or it may be abolishing it, saying, wow, we were not ready to take this out to community events. Really what we needed to do is work in specific programs that already were super ready to do developmental screening. And what that action looks like is going to look different in each community. And the trick is making sure that you really keep people coming back to the table, having honest conversations about where they're at and how implementation is going. The next piece is really around inclusive evaluation. And so if you look at the second page, it shows you a way to make data less scary. Because sometimes when we start talking about evaluating our local efforts, it's like, oh my goodness, we could spend 3 times as much on evaluation and never have resources for services, and that seems kind of wrong-headed. And so if you keep your data simple, relevant, it can really help you out. So here's an example of really setting up those benchmarks to do your plan, do, study, act cycles. You know, one of your measures is going to be the number of children who are screened out of the total number of children that you thought were available to be screened. And so that's one measure that you can look at. Another measure that you can look at is, which is really critical, is the number of families who actually receive the results and a meaningful conversation around those results. So again, those kids are being screened and families are part of that conversation, part of that screening, and then know what to do with the information, whether their child is typically developing or atypically developing. And then finally, we really want to keep track of the number of referrals that are made when there are children who have concerning results, so that way we know that we're really setting up families for success. And so that's a little bit about simple ways that we can measure data. So the final piece is sharing successes. Sometimes we work very hard and we forget to celebrate our successes. And not only do we need to celebrate successes to keep our stakeholders engaged and to keep momentum in a project, we need to celebrate successes because when we do things that work and work really well for children and families, we are able to inspire more folks to get on board to help advance efforts. And if we don't share our success, then nobody knows why they would want to be a part of such a really good thing. The final area on tip sheet 5 is about building for sustainability. And I guess I would encourage folks that while I know sometimes you have to go small and go slow in order to gain traction and momentum, really I invite people to push yourself a bit about who you might have worked with in the past and would be willing to work with again, or folks who you worked with in the past and maybe it was hard, but kids are worth it, so we're going to come back together. Because when we work across systems, even though we don't always see things in the exact same way, we do better by children and families. So there are a few resources that I highly recommend. One of them is the NIATEX website. They really do a phenomenal job of explaining in more detail how to do plan, do, study, act cycles. They are national and international leaders in implementation in the health field and are a good correlation to community developmental screening work. While they're so impressive, their work isn't so heady and theoretical that it's out of touch. It's really practical stuff. And so there are great tools that we can borrow from there. And they're free, and free is good. And then, of course, the Wisconsin Cooperative Education Service agencies, in particular CESA 6, has a great resource on child find early learning resources. And so that helps also think about who in my system do I need to be strengthening or creating connections with. And so that's the skinny in a nutshell on tip sheets 4 and 5. At this point in time, I'm really delighted to introduce to you Sarah Inman and Paula Breeze. They've been working together in Brown County on local developmental screening efforts, and they're doing some really exciting things. And there may be exciting things that you're doing and you say, hurrah, we're doing those exciting things too. And there may be some things that you say, oh my, I hadn't thought of that. And so that's why we bring folks directly from the field, because we know that you all have a lot of wisdom in terms of your local efforts. So with no further ado, I turn it over to Sarah and Paula.
All right. Hi, everybody. This is Sarah Inman. Thanks, Lily. I'm the Community Impact Director at Brown County United Way, and sitting next to me is
Paula Breeze from Family and Child Care Resources of Northeast Wisconsin.
And we are really happy to be talking with you today about what our community is doing around early screening. As you can see on the slide, we have a really active interagency council of mostly early childhood nonprofits and educators, including Paula's agency. That group is convened through United Way as part of our community's Community Partnership for Children. That's an early childhood initiative focused birth to 5, with the vision of ensuring that all of our kids are safe, healthy, and ready for kindergarten. So as part of our effort, we're really proud and happy to have support from, as many of you, the Wisconsin Statewide Medical Home Project, Dr. Ariana Kyle, and the Northeast Regional Center for Children and Youth with Special Health Care Needs at Children's Hospital, Tracy Ratzberg and Amy Diodario. Also, Brown County Birth History. Next slide, please. All right, so when we got together and as a group through the Children and Families Work Group, trying to decide what we wanted to accomplish in our community, we really wanted to coordinate efforts and ramp up screening efforts overall in the community and have that referral process so that no child, especially a child with delays or potential delays, would fall through the cracks. And we're promoting the Ages and Stages questionnaire in terms of the screening tool as a best practice that we're hoping more providers and healthcare systems will utilize in our community. And that's been a process that we'll describe for you today.
And also, it's the Young Star Quality Rating System for childcare also encourages us to be using the Ages and Stages questionnaire. So we know it will be widely used throughout the state with early care and education providers.
Next slide, please. All right, you can see there we have a, oops, back a couple slides. All right, so now we're to the point of the where. So on the slide you'll see a picture, that's a local human service provider that's working with a family, and she is at our Birth to 5 playroom at the Back to School store. The Back to School store overall is sponsored by a local service lead, and we as a work group, 3 years ago, Paula, right? Your third year was this year. We knew that because there were older kids shopping for school supplies and other things with volunteers at the store, but there was really no place for families with little ones to go while they waited for Big Brother or Big Sister. So our work group, which incidentally is chaired by Sue Vincent of Encompass Early Education and Care, I think she may be on the call today, or one of her staff. Thank you very much for your leadership. We wanted to make sure that those families not only had a place to go where the kids could get a children's book or a healthy snack and a growth chart, which I'll talk a little bit about later with Paula. We wanted an opportunity to offer those families preliminary assessment or screen, and those efforts in terms of coordination were led by Vicki Mulvey from Birth to 3 and Jackie Manlick from another agency named Aspiro in our community. So that's one target population and one place-based effort that we're focusing on. We're really reaching out to child care centers through Paula especially because they have child care resource and referral for the region. Home visiting programs, working closely with our school districts, trying to get a handle on what type of screen they use and whether they're willing to potentially switch to the ASQ. We do a lot of brainstorming in the work group. In addition to the Back to School store, we want to start something with Healthy Kids Day at the YMCA next year. So we're starting planning for that. We'd like to tie in with libraries that are already a great collaborative partners with the CPC initiative to have ASQ screens available at the library and staff there who can help parents complete those or take them home and send them back in. And also in conjunction with development days that already exist in the community. Those are a couple of our ideas. Paula, do you have anything to add to that part?
No, we just had a work group meeting and came up with some of those ideas, so we're really excited about that. Knowing also that, like Lily said, the parents, the families have to be involved in this, and the ASQ is really a questionnaire for the parents. So we want to make sure that we're doing it in conjunction with the families and not just as an expert. Families are also the expert in the family.
Then another key thing that we're doing, as mentioned briefly before, We have 3 healthcare systems in Brown County and 4 hospitals within those 3 systems. And all of those systems will be utilizing Epic, either are currently or will be very soon. And so we're hoping, starting with a pilot at Bellin Health, to model the ASQ results being put into Epic and develop more of a more coordinated, again, referral system among not only birth to 3 but other providers who may already be screening utilizing the ASQ. And also the most important thing is to make sure that parents and children are engaged, and we're really aiming for a population level here. If we can pilot with Bellin and then the other 3 hospitals or other 2 health systems will see the benefit, we'll really truly reach that population level of families. Because we know that most families, even if they're low income, are, because of Badger Care, they have pretty good access to health care, and if they're really in dire straits, they will have been engaged by hopefully one of our nonprofits in the community as well. So that web taken all together between the event, the medical community, and then nonprofit providers and school districts, we're hoping to cast that wide net as our planning ramps up. Next slide, please. All right, so as Paula knows, because she's been a member of the work group since its inception, we had for many years discussions about the need for a coordinated system. I don't know if you want to talk about that at all.
Yeah, I mean, I've been a part of the work group since 2006. Yep, 2006 we started the work group. So, you know, we've really tried to work, you know, as a county instead of as individual organizations to really see what the needs are in the community and where we can, as a coordinated effort, you know, make those connections and help families become successful. So. And we went to the webinar in May of last year that the collaborating partners put on a screening and in system-wide screening, and so that's where we really started to actually then have a little bit of subgroup of people that met together and decided we really wanted to move forward on this and that this was really important for the community.
And it was really kind of neat sitting there because we had, Paula and myself, we had a community member who's a business stakeholder, Janet Minks from Encompass, and several others, and we were just really energized in learning about what other Wisconsin communities were doing. We knew our idea wasn't an original one, of course, but it was really great to hear the different examples of, you know, the wonderful things that are going on around Wisconsin, and both small and large scale. So that was a really pivotal moment for us. Next slide.
Sarah and Paula, before you switch slides, there's a question from Kimberly, and she's asking if maybe you could say a little bit more about how you work with the school district and whether or not they use the ASQ. And if
Sure.
they don't use the same tool, how does that affect your collaboration for kids birth to 5?
Well, we have 8 school districts within the boundaries of Brown County, one of which utilizes the ASQ. Our largest school district, Green Bay, does not. However, the Head Start program utilizes the ASQ social emotional for evaluating kids. But they've been really great partners in terms of promoting and helping out with place-based events. School district representatives serve on the work group. And by collaborating together in that way, we can also make sure that we connect families who are entering 4K or 5K right away. They need assistance, and hopefully even earlier than that through birth to 3, and have that seamless pipeline going on. So, in answer to the question, it varies by school district, but every time we've approached a school district for partnering on an event or those types of things, it's gone really well. It's just difficult overall because school systems have so many different mandates coming down from either state or the federal government, and they all have different ways of determining what they'll be assessing, at least in this area. It's it's kind of a patchwork, but you know, it's been successful just in the ways that we've been collaborating so far.
Thank you.
So from the field, why? So why do we want an early screening system here in Brown County? Again, we have no baseline information for individual child development prior to kindergarten. So, you know, it's kind of been piecemeal. You know, there's developmental days, you know, in this school district, and this school district doesn't do developmental, you know, days, but they, you know, refer kids that they know need, you know, additional support. But there's really no really coordinated way to do that. So, you know, a lot of the kids are falling through the cracks. And so we want to make sure that we catch these kids really early, that they can get the supports that they need before they're anywhere near 4K or 5K. Again, we have validation from the national level. You know, the American Association of Pediatrics recommend that all children be evaluated at the 9, 18, 24, and 30 months of age using something like the ASQ. So I think that that's been, that has helped us as a work group move forward and know that this is the right direction in going. And the quality of care, early detection of delays as early as possible. It's critical, you know, for the children, making sure that children are linked to the services. We have a really service-rich county, and we know that. But if families can't access those services or they don't know that they're there, there's no way for them to be able to get those services. Again, fostering that, you know, healthy interaction with families and children. That's another great, you know, positive outcome. And then lowering that parent frustration, you know, that possibly can, you know, reduce the abuse and neglect, because when parents are frustrated, you know, that's when, you know, things can happen. So connecting them to those resources early is really a big key.
Next slide, please. All right, and just to recap, relating to the ASQ in particular, in case there might be those of you out there who aren't really familiar with it, we've found it to be the most utilized, at least within our community, and nationwide, I believe. And it's just a really great tool. Like Paula said, it's engaged to engage the parents and be completed by the parents. So we think that's really important. We know that from the provider side or the physician side, especially from Ariana Kyle, who I mentioned earlier, that's worked with many communities, we know that the ASQ becomes a time saver because it identifies those concerns right away. And it's a big part of well child care provision, whether it's on the medical side or the nonprofit human service side. So we reinforce those messages wherever we go. And you know, the trainings that are coming up hopefully soon within pilot felon clinic sites will expand upon that message, and we'll hopefully get huge buy-in from the physician community there. Next slide. All right, this is a really busy slide. Sorry about that. But we wanted to put as much information in there for you as possible if you happen to be a community that's just getting started. And that being said, we're only midway through, so we're an example of a system that's definitely evolving incrementally.
Yep, we're in process still.
Varying stages of progress, as it notes on the top there. So we started out in terms of trying to get a bigger picture of the landscape of who was using the ASQ, who wasn't, who might be willing to switch, provided training outside of our work group, because obviously within that work group we know who's doing what. So I know, Paul, if you want to talk a little bit about the biggest population that we surveyed was child care providers.
Right, we did. So again, you know, we have access because we're a resource and referral also, and so we surveyed child care providers and other nonprofits in the community to find out what kind of screening tools they were using, if they had heard of or were using the ASQ. And again, if they really had the support, would they be the one? Would they change to the ASQ? Because we want this to be community-wide, we really don't want to, you know, be having, you know, 10 different, you know, screening tools being used, and then trying to be able to weed out and figure out what matches and what doesn't. And then the identification of the existing community events, things like the back-to-school store, child development days that are already happening. The YMCA has a big kids day where they have a lot of kids setting up a little room or a little space where that's a possibility.
And then, as I think I referenced before a couple of times, Bell Health, we've been meeting with them extensively, representatives from the work group and then our partners statewide and regionally to identify clinic sites and hopefully get started there by early 2013, still in progress in terms of planning. And then the last bullet on that slide, this is our really ambitious big dream. So we've spent, as a United Way in particular, more than a year of research and planning into what we're calling a community information system. And the foundation of that system is web-based software that we hope to, including Paula's agency and many others that are partnering on our Community Partnership for Children initiative, have them be able to utilize that software for coordinated case management. And included in that piece is also the ability to record and tie ASQ scores to individual child records. And that's key because, there are websites out there where you can send parents and they can plug in and get their results. But then it's not really tied to anything. And there are also data systems you can utilize, but they're just kind of standalone. So our system has a more integrated approach, and again, the ASQ piece will be part of that, and we're looking forward to be able to see some point-in-time results for children by age. And we're also helping to interface with EPIC that I mentioned before, since all of our health systems are going to be utilizing that. We're hoping to have some sort of tie-in with that, but still in the planning stages. So we're excited about the potential for the information system, just in terms of benefits to the provider community and to families, improved coordinated case management and family teaming, and then the ASQ tie-in as well. Next slide. All right. So some tools that we've created under how are we doing this. As Paula mentioned before, the Children and Families Work Group has been meeting every month to United Way since 2006, and it's such a great group. If everybody could attend every month, there would probably be about 40 people in the room from various agencies and schools in the county. So it's just a really action-based group, thus its name. And one of the things that we created along the lines of not specific to the ASQ, but relating to child development and wanting every parent in the county to know, at least on a baseline level, what should their child be ready to do at 4 and 5, and all along that age spectrum from birth to 5 in 4 key domains of development. So you can see a smaller version of the Stepping Stones growth chart on the screen there. That was developed in collaboration with the work group and our local Chamber of Commerce's Partners in Education program, because they had, their board includes all superintendents from the school district, so we thought that would be a great tie-in. There was kind of a subcommittee that was developed, and that included people like Paula and other early childhood experts in the community, plus educators. And we spent 9 months determining what would be on this growth chart. In addition to those developmental domains, it has information on how to contact 211, how to access FromHoneyChildren.org, which is where there's a link to our parenting resource website, and you have a different link that will bring you to the same place on that screen as well. We've distributed about, I would say, 25 to 30,000 of these since 2009 in all kinds of venues, whether it's child care centers or schools or you name it, libraries, businesses. It's really gone over well, and we've shared it regionally too with others, so that's been really great. We also have a child development referral brochure specific to families who might have concerns about early delays. All of the phone numbers for birth to 3 and all the early childhood folks at the school districts are listed, as well as some milestone information on a smaller scale than the Stepping Stones growth chart. And just in general, the site is a really rich source of information for families and providing free information, including the Parenting Warm Line at Family and Child Care Resources, which is a great resource in our community.
Right.
Great. I think that's the last slide. I'm pretty sure. Yep.
Great. Well, we want to thank you so much. And I know that there have been some questions that have been coming in, and a lot of questions with a central theme about, say, what's the difference between the milestone work that I'm already doing and the developmental screening. And one of the things that's really great about milestones is, as a promotion strategy of parents and professionals really understanding child development, it's great in terms of promotion. In terms of using milestone checklists to actually identify whether children are typically or atypically developing, it's not valid and reliable. That means that there are a lot of kids who get missed if we stop there at milestones. So it's a good first step, but it's not going to really get at our long-term goal. If our long-term goal is really to make sure that all kids who could benefit from additional supports are identified as being in need of those supports. The another question that came through is if whether or not you're able to keep the brochure current as staff and agencies change. And you know, I think that communication loop is always really challenging. And so what I can just encourage folks to do, it goes back to those earlier pieces about stakeholders and engagement, that you're more likely to keep that feedback loop working if you're meeting regularly and not only when there's a challenge or a breakdown in your system. So, you know, in terms of how a coalition supports child care programs to implement the ASQ3, I really appreciate you saying that, because sometimes, or asking that, sometimes what happens is we stop looking at child care programs as system partners, and we see child care programs in a more too limited and unhelpful way as only the folks who are delivering direct service. And so I think you're absolutely right to ask, how do we do a good job of connecting folks? There's no one right answer, but what I can say is that communities who are really onto something work out systems to share the results of developmental screening back and forth. So whether that developmental screening is happening at their child care program, whether that's happening at their Head Start, whether that's happening in their Birth to 3 program, or their home visiting, or it's happening in the doctor's office. Some programs have been really successful, or communities have been successful in developing a passport, so that way families can take that information with them and share it easily. So that way we don't keep spending time doing screening when we could be spending time actually responding appropriately to the needs that children have. So, great questions. I know that there are many more questions, and we are running short on time. But I just want to thank everybody for all of the time you've taken. And so we have a few more questions. We can take a few more questions if you have any. So anybody else with questions or ideas, feel free to type them in. One of the questions that we'll take back to you, Sarah and Paula, when you were talking about, you know, really working with each partner and understanding where they're at, and knowing that right now the school district isn't in a position to necessarily focus only on developmental screening because there are other mandates that they are needing to respond to. So can you say a little bit more about how you bring folks into a collaboration and keep them in a collaboration even if they're not able to do, you know, exactly, you know, what your aim is yet?
Well, I would say, you know, everybody has something to bring to the table, and everyone's contributions are valuable. So I'm trying to remember back to all the things I said about ways in which we work with the schools and school districts. But you know, the main thing is the work group provides a great venue for participation in ASQ-related events, and we're ramping those up like Paula and I talked about. And it also provides a great venue for deeper collaboration with the broad range of providers around the table. So it's a great means of networking. You're uniting around a common cause and a common issue, and at the same time you're building relationships that last, you know, long beyond the meeting. And we've come up with some great collaborative programming ideas And you just have to keep working toward that goal while realizing that not everyone will be able to do exactly, certain things. But it'll all work out in the end.
All right.
And that definitely has taken time. I mean, I think what happens is, at the beginning it was really hard because we typically, when we're from a nonprofit, we have our own hat on and from our own agency and our own goals and our own funding, and so that is difficult. But I think once we started meeting and realized that hey, these are still common goals, even though they don't impact my agency or my clients or my kids directly, it makes a difference in the community. And so I think that just happens over time if once you start meeting and people can be on board with supporting each other along with their own particular agency.
Thanks, Paula, and thanks, Sarah. Say, another question that came up is, more about what's available to support child care programs and using the ASQ. So there's some very low-cost training that's available through child care resource and referral agencies. Brooks Publishing has worked with SFTA and child care agencies to be able to provide access as a resource, but not as not as a breach of copyright, but as a training material to help folks actually get in and roll up their sleeves and practice with those screening tools, so you can see what they look like for different ages. So if this is something that you're excited about and you're looking for a place to start, you'd be in a great position to contact your local child care resource and referral, and they can help you connect up with services. And I know that UW Extension has done a lot of support to folks around understanding ages and stages questionnaire if you are in the home visiting or parent education venue. So there again, and if you call one agency, you could call any of the agencies that are listed on this PowerPoint, and there's no wrong place to reach out. We'll point you in the right direction. So there's a question about what about obtaining a release of information from families. And so when developmental screening is done in the context of an ongoing relationship, either in a pediatrician's office or through ongoing parent education classes or a family resource center or at a child care or Head Start program, obtaining that release of information is easier. If it's being done in the context of a community fair, that's one thing that community stakeholders really need to think about, which is how are we going to invite families and parents as part of that invitation process? Are we going to secure the parent consent and the release forms, or are we going to do that on site once folks show up and do it in the moment, so we make sure that everybody has that? Those logistical questions are resolved differently in different communities, but I think that it's wise to ask that question about obtaining that release, because screening, again, in and of itself, not connected to families or parents, is really problematic in terms of being able to do that meaningful follow-up, which is kind of key to doing this work ethically. There's also a question that's come up about how to get this PowerPoint and whether it will be available to print. It absolutely will be available to print. It'll be posted on the website. I'll let Jenny tell you a little bit more about that.
All right. So as Lily mentioned, the PowerPoint will be available, as will the archived webinar. If you can give me a couple of days, it should be posted early next week. But again, both the webinar archive and the PowerPoint will be on the website, and I'll show you that website in just a second here. So here, this link is where you can register for the upcoming webinars, and we're taking a break over the holidays. The next webinar will be in June. So you can go to the Collaborating Partners website to register for future webinars. You can see the archived webinar from October, and the archive for this webinar will also be on this same website. Are there any last questions before we kind of wrap up here today? I'll give folks a second to type into that chat box. Someone said I said June, but I did mean January. So here's a list of the upcoming webinars. So on January 17th, we'll have tip sheet number 6, Engaging Parents. February 21st, tip sheet 7, Sharing Screening Results with Parents. March 21st, tip sheets number 8 and number 9, sharing screening results with partners and using screening results. And finally, on April 18th, tip sheet number 10, culturally and linguistically responsive screening practices. So we hope that you'll be able to join us for any or all of those webinars. And if you're not able to join us, we hope that you'll access the archive webinars following the actual date. And we're excited that so many people have been interested. So again, here is that link to register and to get all those archived materials. And I want to, again, thank Lily and Paula and Sarah for taking time to participate today and to present and to share such great information with us. We really appreciate their time. At the top of the slide is a link to a SurveyMonkey to evaluate today's webinar. But please watch for an email from me, Jenny Maurer, that will contain that link to the SurveyMonkey to evaluate today's webinar. We are still diving into the results from the last webinar, and we're really excited to hear your feedback, because as Lily mentioned earlier in the presentation, we've shared some great information here with you today, but we know that there's lots of great stuff happening out there, and we're really excited to learn together about how to take a community approach to developmental screening. So I'm going to, again, thank everybody for joining us today and taking time out of your busy day. And we look forward to talking with you at the next webinar in January. Have a great holiday season, and have a great day. Thanks so much, everyone. Bye-bye.